Hello everyone, welcome back to my channel. As I promised you all for the new Perio classification, so I already made this new PowerPoint presentation for you guys. I hope this helps. This is all I myself studied for the exam, and this was more than sufficient to answer all the Perio questions when it comes to staging or classification. Once again, we know that this new Perio classification is something that all the dental board exams, be it in America or Canada, we these students are evaluated upon. So the questions will definitely come on this topic. Yeah, I have even included one practice question in the end just to give you guys an idea how to do it or how to answer those kind of question. It's just a simple question. So going ahead, if you again once again, if you all have any questions, feel free to ask. Be it through the comment section or through a private message. In my email or my Instagram account, you guys can go ahead and just text me or drop me an email. So let's go ahead and talk about different forms of periodontitis. So there are three kinds of periodontitis. One is mild, moderate, and advanced. Now, we know that when it comes to periodontitis, there will be probing depth, there will be bleeding on probing, there is going to be bone loss when you are going to see radiographically, and definitely there will be a clinical attachment loss. This is a question also comes in lots of board exams do ask, what is the determining a definite determining factor for periodontitis? It is basically the clinical attachment loss. If the clinical attachment loss is not present, then it is not a periodontitis. Now let's go ahead for the probing depth, especially for the slight and the mild cases. The probing depth is equal is will be more than 3 or less than 5 millimeter. So anywhere if it is 4 millimeter less or equal to 4 millimeter, right? That is going to be our mild periodontitis. The moderate is going to be more or equal to 5. Sorry, I just didn't know how to make this sign. So it is supposed to be greater or equal to 5 or less than 7 millimeter. So I would say that less or equal to 6 millimeter. Sphere will be more than 7 millimeter probing depth. Bleeding on probing is going to be a definite criteria, will be present in all the three criterias. And the radiographic bone loss, when you will see that when you take an x-ray, there is going to be a radiographic bone loss in periodontitis. It is going to be up to 15% of the root length. So if we have a tooth and the root length, the radiographic bone loss is going to be 15%, or you can say that it will be greater or equal to 2 millimeter or less or equal to 3 millimeter. For the moderate one, it is going to be 16 to 30%, or it will be more than 3 millimeter and less or equal to 5 millimeter. For the advanced one, it is going to be more than 30% or more than 5 millimeter. Clinical attachment loss is very important because that will definitely be given in a question when it comes to classification, that there is a clinical attachment loss of 1 to 2 millimeter, there is bleeding on probing, what kind of periodontitis it is, then the answer is going to be slight or moderate. They might even mention the probing depth. So this is something you guys need to understand. So this is again an example of a question that I'm giving over here. If in the question, if it says the clinical attachment loss is 1 to 2 millimeter, there is bleeding on probing and the probing depth is 4 millimeter, so it is going to be a mild or slight periodontitis. For the moderate periodontitis, the clinical attachment loss is 3 to 4 millimeter, and for the sphere it is more or equal to 5. Again, for the moderate, if the answer has to be moderate, the question is going to be like there is a clinical attachment loss of 3 to 4 millimeter, because if they want you to talk about classification and periodontitis, the question will definitely talk about clinical attachment loss, and that is something that will definitely be there. How much is the clinical attachment loss present? So do make sure that you guys do remember how much is the clinical attachment loss. Now, moving ahead to our next slide, let's talk about staging. This is again something that they definitely a question definitely comes on it. Now, for severity and the complexity, there are the periodontitis is classified into stage 1, 2, 3, and 4. Now let's talk about interdental clinical attachment loss. So the clinical attachment loss, we know that can happen on if there are four different sides of a tooth, it can happen on all the four different sides, but you have to see the clinical attachment loss at the site of the greatest loss. So when if the clinical attachment loss at one point is 3 millimeter, at the other point it is 4, so you're gonna you're gonna record the clinical attachment loss at the 4 millimeter. So for stage 1, the clinical attachment loss again is going to be the same way as we read in the previous slides: 1 to 2, 3 to 4, and more than 5, right? So 1 to 2 millimeter, 3 to 4 millimeter, stage 3 and stage 4 are the same: more or equal to 5, more or equal to 5. Now, RBL is the radiographic bone loss. Again, it will be the same way as it is over here in the previous slide. It will be coronal third, less than 15%. Again, the stage 2 will also be in coronal third, 15 to 33%. And in stage 3, it will extend to the middle third of the root and beyond. So in stage 3, it will be extending to the middle third of the root. Same will be stage 4, it will be extending to the middle third of the root and beyond. Now, tooth loss. There will be so tooth loss again due to periodontitis. For stage 1 and 2, there will be no tooth loss. For stage and 3, will be less or equal to 4 teeth will be lost, and for stage 4, more than 5 or equal to 5 teeth will be lost. So you guys will see over here that there are different for stage 1 and 2, the evaluation criteria are quite confusing, and so is for stage 3 and 4. So when it comes to that point where you're confused if it is stage 1 or stage 3, 2 or stage 3 or stage 4, you go ahead and then look for additional points, and these are the additional points. Now, for stage 1, the maximum probing depth will be equal to less or equal to 4 millimeter. So the probing depth for stage 1 is going to be less or equal to 4 millimeter, and there is going to be mostly horizontal bone loss. For stage 2, there will be less or equal to 5 millimeter, and again the bone loss will be horizontal bone loss. For stage and 3, there will be vertical bone loss now. In addition to stage 2, there will be probing depth that is going to be more than 6 millimeter. The vertical bone loss will be more than 3 millimeter. This is something that they do give in the question, that there is a vertical bone loss of more or equal to 3 millimeter. And then I do not know about you guys, but I would always get confused that maybe it is stage 4, but no. Please pay attention that the vertical bone loss of greater or equal to 3 millimeter is stage 3. There will be furcation involvement, and that furcation involvement can be class 2 or class 3. I'm not going to explain over here what is furcation involvement classification, because that's a separate topic, and I'm hoping so far you guys know. If not, then I will be making another video separately for perio other topics, and we will cover that there. And there is going to be ridge defect, but the ridge defect is going to be moderate. Now, for stage 4, there is going to be masticatory dysfunction. The patient might not be able to chew food properly. There will be secondary occlusal trauma is associated with stage 4, and there is going to be severe ridge defect. Over here there is moderate, over here there is severe. There will be bite collapse, there will be drifting and flaring of the teeth, and less than 20 teeth remaining. So in the question, if they are saying there are less than 20 teeth remaining or 10 opposing pair, then it means the same thing. Now, extent and distribution. Sorry about that. So let's talk about extent and distribution. In the extent and distribution, we know that there is going to be localized, generalized, or the molar incisor relationship. This is something that they changed from the previous one. Now they talk about molar incisor relationship. Now the localized means there will be less than 30 teeth less than 30% teeth remaining. Generalized means more generalized, more than 30 percent of the teeth involved. And then molar incisor means that the periodontitis is only limited till molar and incisor. So the state for rest of all, it's the same. Now let's talk about grading. Again, the question do come on grading as well. I have gone through, I'm sure if you guys have given any of the board exams more than once, you know that questions on grading does come. So the periodontitis grading is grade A, grade B, and grade C. So the grade A is also called slow rate, moderate rate, and rapid rate. So the primary criteria is basically the direct evidence of progression, radiographic bone loss, or the clinical attachment loss. For in grade A, there is going to be no bone loss over 5 years. For grade B, it will be less than 2 millimeter over 5 years, and in grade C, there is going to be more or equal to 2 millimeter over 5 years. Now, indirect evidence of progression is percentage of bone loss versus age. So what does this mean? Why did I mark this as percentage of bone loss? Sometimes in the question, I don't think so in INBD I've ever encountered that question, but if they ever, especially for the Canadian boards, if they ever want to make the question complicated, they might give you the amount of bone loss and they might give you the age of the patient. So how do you calculate that percentage? Is that the amount of bone loss divided by age will give you the percentage of bone loss. So for grade A, it is less than 0.25. For grade B, it is 0.25 to 1, and for grade C, it's more than 1. Sometimes in the question they just directly talk about that the bone loss is more than 1%, so you just right away know that it is grade C. Now again, case phenotype, heavy biofilm deposits will be there with low level of destruction. So the plaque level is going to be there will be heavy plaque, but the destruction is going to be low. Again, for grade B, there will be destruction with the biofilm deposits, means that the destruction and the biofilm deposits are the same, or the plaque is the same. So grade C, it is the destruction is going to be more than the plaque deposits. Now, risk factor, the two main risk factors in grading are in periodontitis are smoking and diabetes. So grade A is going to be non-smoker and non-diabetic. Grade B is going to be less than 10 cigarettes per day, or half a pack, we can also say. For grade B, the HbA1c, which is the criteria to evaluate the person is diabetic or no, is going to be less or equal to 7% in patients with diabetes, and for grade C, it is going to be more than 7% in patients with diabetes. Now, in the question, this question does come where they talk about that they might give you all the criteria of grade A, means that there is no loss of bone over 5 years, or the percentage of bone loss is less than 0.25, but the patient is a heavy smoker or a heavy diabetic, or she is smoking a pack of a cigarette per day, or her HbA1c levels are more than 7%. Right away the answer is grade C. Please, this is very important. This question does definitely come. So at the end of the day, you have to see the risk factors when you are answering that question. If they are talking about uncontrolled diabetic patient, or this patient is smoking more than almost a pack of a cigarette a day, but in the question they are giving you all the criteria of grade A, you might get confused. No, so please go ahead and answer right away. The answer is grade C, and I've also included one of the questions just to practice for you guys over here. Now, this question says that over a period of 5 years, multiple recall appointments confirm that an uncontrolled diabetic patient in your clinic have lost 1 millimeter clinical attachment. What grade it is? Now, if we guys go ahead and see the clinical attachment loss, it will talk about stage 1. So right away, when you see that as in the question that the attachment is only 1 millimeter, you might be tempted to answer grade A. No, please. Over here, it talks about uncontrolled diabetic patient. The answer is right away grade C. So please do understand the question and do understand the classification and how to answer these questions. They might look easy, but they can get tricky. I hope so this was all for the new Perio classification, and I hope that it was helpful to you guys, and I hope that this I was able to give you guys a better idea or better clarification when it comes to this new Perio classification. And if you and I also did another poll over my Instagram account, whether to if you guys want a new caries classification as well, means PowerPoint on the new caries classification, because that's something also a new update, and board exams are evaluating students on on that topic as well, and most of you guys did answer yes. So I will be doing a new Katie's classification PowerPoint as well, so please stay tuned. And if you guys do think that any of these PowerPoints are helping you guys in the board exams, please do like and subscribe, and stay tuned for the new Katie's classification as well. Wishing you all the best who all are appearing for the exam anytime soon.